Well, hello and welcome to Reinventing Mental Health, where we are talking about root causes for mental health symptoms. Today, we have our friend Dr. Val Franc here to talk to us about the connection between hormones and mental health. So, Dr. Val, can you tell us a little bit about you and your history and how you got here today?
Sure. So basically, with respect to how I got started, I was doing an undergraduate degree in nutrition at a very wonderful university here in Canada. And what ended up happening is I graduated with my undergraduate degree. I was going to be going on to my master's. And sure enough, my health started to suffer.
Oh, no.
And yeah, I was sleeping 10, 12 hours. I'd be up for an hour. I'd have to go back to bed, and I was just exhausted all the time. And so I knew something wasn't right. So I thought, okay, I'm going to go to my medical doctor. She was very well trained, this amazing woman. She did everything a medical doctor could possibly do, all the tests under the sun. She was so sharp, so brilliant. And she just said to me, everything's normal. This is just stress. Go home and sleep some more. So you can
But that
imagine,
already wasn't working.
right? I'm like, okay, that's called a coma. Not quite sure I can handle that, and it's just no way to live. I'm like, okay, I'm sick and tired of being tired, right? And I know that even though all of my blood tests are coming back saying that everything's normal, something just is not right.
Okay.
So my aunt just said to me, "Hey, why don't you go see a naturopath?" So I was like, "I have nothing left to lose. Why not?" So I went, and the naturopath looked at me and he said, "This is your foods. This is your diet." Now you can imagine this cocky little university graduate with the nutrition degree said, "This can't be my diet. I'm a nutritionist. I know everything," right? Because you think you do at that age. And I was convinced. And so we just did some very specific type of testing. Turns out that I had some food sensitivities, and I was allergic to life. I was basically, "Oh, okay, I can drink water and breathe." I cried. I was like, "What's going on?" And then, basically, once I started implementing the strategies, my health turned around like that. And it's interesting because at that point in time, if you asked me, "Did you have hormonal imbalances?" I would have said no. And he did ask me. He was like, "Okay, well, what's going on with your hormones?" I'm like, "Everything's fine." He's like, "Oh, menstrual cycle's fine." "Yeah." "Did you get PMS?" I'm like, "Oh, yeah, just the normal symptoms." He's like, "Okay, guess what? Those hormonal symptoms, that what you're calling PMS, that is very common, but you don't have to have that. So just
Right.
because something is common doesn't mean it's normal." And I was like, what do you mean? That's a game changer. Everybody I know has something. And he's
Yep.
like, "No, they're not supposed to." And so we did just some little fine tuning and it went away.
Okay.
And I shed about 15 pounds without changing anything, without increasing exercise. And I know I changed my foods to get rid of what I was sensitive to, but I didn't say like, "Oh, I've got to cut out carbs or I've got to cut out this or that." No focus on weight loss at all. And it just shed. It was all inflammation.
Yep.
And so then I was hooked. I'm like, "Okay, you guys have secret knowledge. I want to know what you know."
Yep.
So I went to the naturopathic college, one that was here in Toronto. It's called the Canadian College of Naturopathic Medicine. And I graduated at the top of my class with honors. Of course, again, won this nice little award for being the best at nutrition because I could eat, breathe, and sleep it. And I was hooked. And then I got out into practice and I thought, "I'm going to heal the world." And when I got out there, I was like, "Oh, wait a minute. I've got these great protocols, but not everybody can." In fact, the majority of people are going to have a rough time implementing these strategies. So then I started getting interested in the mind body connection. And so I went and studied hypnosis. Then I decided, hey, you know what? I want to learn more about traditional Chinese medicine and about how they incorporate not just acupuncture and herbs, but food. And then when I was in China, I got hooked on yoga and decided I'm going to learn about Ayurvedic medicine and how they look at medicine and the body and herbs. And so I did that, and I became a yoga instructor and really started connecting a lot of the mind, body, and spirit. And I was seeing they're so interconnected.
Mm-hmm.
And so throughout this time, I was beginning to realize how much my hormones were really a big part of how I was feeling. And so around the age of 35, I was under a great deal of stress, and I had developed hormonal issues then, which I then went on and just healed naturally through, shifting up my foods to rebalance the hormones and doing some things to rebalance the hormones. And then again, when I hit 47, I was working with a lot of high performers. And what ended up happening for myself is I started to gain weight. My hormones started to shift in what people would call like the perimenopause type symptoms. I had no other symptoms other than I just gained an extra couple of pounds, but not very much, maybe like an extra 5-10 pounds. But I couldn't, no matter what I was doing, it would not shift. I hired a personal trainer that I had actually trained because I taught at both at the Canadian College of Naturopathic Medicine and the Canadian School of Natural Nutrition. And so he was one of my nutrition students who was also a bodybuilder and put other bodybuilders on stage. Really great guy, but he didn't have the answer for me. And he's like, I don't get it. He's like, I know you're doing everything I'm telling you.
Yeah, and women's bodies are so different than men, especially when we're going through that perimenopause phase.
That's exactly what happened. So I actually started doing my own research, and I discovered, oh, you can eat a very specific way and exercise a very specific way. So I started eating more and exercising less, and I dropped the weight. And I got really curious, and I was like, okay, well, what can my body do? Right?
Yeah.
What can this sucker do? And I actually, just without counting calories, without counting macros, without starving myself, and without being in the gym more than 2 days of the week, I got down to 14% body fat.
Wow.
And I kept my menstrual cycle. So, again, it wasn't forcing my body into anything that it wasn't capable of or possible with. It was actually fueling and nurturing it. And so, then track forward, and I started working with a lot more athletes, a lot more female athletes, and a lot of high performers and CEOs, and their hormones really go off balance really quickly. And so started to design these wonderful protocols for helping, just in terms of really supporting women through different stages of training, different stages of support while their hormones are shifting, and helped a lot of women just transition through menopause seamlessly.
Menopause is such a hard time for women, and we see mental health symptoms pop up pretty largely during this time. Depression, anxiety, troubles with sleeping, a lot of body image issues because they're putting on weight and they can't, just like you said, they can't figure out, why am I putting on this weight? I'm doing all the things. So yeah, a lot of women, I'm sure, resonate with that. And then the high performers, like, their cortisol levels are so high and their homocysteine is always elevated. And, that has a major impact in the hormones.
And quite often, when I look at the nutritional information that's out there, 90% of it is wrong.
Mm-hmm.
And again, when women are performing at higher levels, they're fueling and exercising themselves like men when they train. And our hormones are so different. Our body's biological needs are so different. And so, with respect to even among women who've experienced a lot of trauma in their childhood, their hormones will go out of balance a lot easier than women who haven't. So when we're taking a look at those experiences around hormonal shifts, mental health does flush to the surface really quickly because the hormones can go off balance a lot quicker in people who have had a lot of trauma.
So in your experiences and all of this work that you've been doing, what would you say is the most surprising thing that you've learned about hormones and their influence over mood and mental health?
The most impactful thing that I think when I talk to my patients about is actually that hormones are real.
Yes.
And we forget it. And it's one of those things, like, feminism and the rise of women moving into the workplace, and a lot of the shift in terms of the culture around women being recognized as, oh yeah, we're just as smart as everybody else.
Mhm.
And we can do everything that everybody else can do.
Yep.
Those are all really positive and wonderful benefits, and it's been so great for women on so many levels. And there's this one small, tiny area that I think we need to work on. And it's, we forget that just because we can do all of those things and perform at all of those levels and, excel, and, we're equally as capable as everybody else on the planet, we forget that, wait, but hormones are real. And it's almost like it's a dirty little secret, or you can't talk about it. And
Right.
so
Yep.
many women, yeah, and so many women, when they're in the weeds and the
Mhm.
hormones are shifting and it's affecting their mental health and their cognition, they don't see it in that moment.
So
And
many of them, I find, haven't realized that their parasympathetic system has moved into fight or flight, even though this isn't this traumatic experience. This is, I'm working at a high level. I am successful. I'm managing a business and a family and a marriage. And their system gets thrown completely out of whack, and they're not tying those two things together.
absolutely. And so, with respect to stress, for 90% of the people that I talk to, if I say to them, are you under stress? They'll say no. And they think that stress means they're having a mental breakdown. They're not crying, they're not
Mhm.
upset. They've got maybe even all these good things going on. They've got deadlines, they're getting promoted, they've got like this, great big huge new raise. They've
Absolutely.
got the things, the house, the kids, like they feel like they've got it all, they're doing it all. And that's great. But guess what? The body does not recognize the difference between, oh, I see a tiger. Should I hit it on the head, or should I run
Mhm.
away? Versus, oh, my boss has this deadline for me. Should I hit him on the head or run away? Like, it's the same hormones coming up. And the same hormone that gets us excited
Mhm.
also is cortisol, which is the same one that gets us under stress.
Yep.
So we have to start shifting the conversation around what is stressful for you, and what you perceive as stress versus what your body perceives as stress are very different things. And
Yeah, we have that conversation a lot inside the mental health space while we're working with people, and they're talking about, my life is wonderful. This is happening, and this is happening, and this is happening. Yeah, but do you understand that your body right now is getting cortisol from you going through the mortgage process? You're getting married. You just took a promotion at this job. Like, your body is not responding to this necessarily in the way that you're perceiving how your body should be responding to this.
right. And,
Mhm.
for yourself, even, and for myself, as, very busy practitioners, as clinic owners, as, wanting to be of great service in the world, and we're
Mhm.
performing at these higher levels, working with people like that, I always give them this analogy, and I say, listen, it's like, that analogy of the frog, if you put it in the boiling water, if you put it in like, if you put it
Yep.
in boiling water, it's going to hop out too hot. But if you
Yep.
slowly turn up the temperature,
Mhm.
it's going to stay in, and it's going to boil. So with respect to the frogs, I'm like, okay, you're that frog, the water's boiling and you're doing the backstroke. That's where we are right now. So,
Mhm. Yep.
let's we got to start changing the conversation around what is stress, and then
Yeah.
how do we manage that.
And can you explain in simple terms how hormones like cortisol and estrogen or testosterone can act like messengers to us for our mental well-being?
Yeah. And, in terms of, mental health, I think
Mhm.
we need to start reframing what we call it. Because to say mental health, it sounds like it's all
Mhm.
in the brain. Oh,
Yep.
it's all in your head. Or hey, we're just looking at, dopamine levels or serotonin levels or GABA levels. And
Mhm.
so those are some of the hormones that the brain produces. They're called neurotransmitters, actually, that help in terms of mood, but they don't just stay in the brain. They
Right.
move through all of the other areas of the body. And guess what? Serotonin, the happy, feel-good chemical, which allows us to be happy, a large portion of it, the biggest portion is produced in the brain, but the second biggest is in the intestinal tract. So you have other areas of the body that have the capability of producing neurotransmitters, number one, but you also have the ability of hormones to influence the brain.
Mhm.
So cortisol is a hormone, it's the stress hormone.
Yep.
And when you have a high amount of cortisol, it actually gets into the brain and it shuts down the blood flow to the front portion of the brain, which is reasoning and logic, which is why road rage is a really big thing right now, because you're trying to get to where you want to go, they're trying to get to where they want to go, and then there's traffic and suddenly this guy is like honking at you, throwing his banana, right? Because cortisol level goes high.
Yep.
And you just
Yep.
and no one's thinking. And so every time you're like, oh, that person is so rude, they just cut me off, like, didn't they, couldn't they see me here? Probably not. And they're not thinking of you, and they didn't do it intentionally. They've got high cortisol. They're not really, the logic is gone. So you don't even try to have conversations about being rational. It's not going to happen when cortisol is high. But then blood sugar levels, like, what happens? You're running out the door, you're going into traffic, you forget to pack your lunch, you didn't have breakfast, and your sugar levels drop.
Absolutely.
If your blood sugar levels go too low or too high, let's say here in Canada, we have Tim Hortons, and they came up with something that they're calling the Gretzky, because Wayne Gretzky, very, very famous, beloved hockey player here, his number was 99. And so the Gretzky coffee is 9 creams and 9 sugars.
Oh my heavens.
Right? It became a thing. I don't know. And would you order a donut or some little Timbit?
No.
Like, the sugar content going into your brain, there's no way. And with coffee, like, the caffeine is going to raise adrenaline levels. It's going to raise cortisol.
Yep.
You're just going to be having all of this sugar going to your brain. You're going to have the blood flow shutting down. There's no way you should be driving a motorized vehicle.
I don't think you should be doing much of anything with that much sugar in your body. My goodness.
Right? So with respect to having that lifestyle, again, if your sugar levels are going too high, if they're going too low, that's going to affect your ability to concentrate and focus. Now, with respect to the hormone balance, again, when you're looking at mental health issues, or let's call them neurobehavioral disorders, because really it's happening through all of the body, there's a very strong correlation with hormone balance. So a lot of neurobehavioral disorders, again, like any type of psychosis, if you're looking at manic depression, if you're looking at schizophrenia, a lot of that is triggered right around the menstrual cycle. And it gets worse for women when they're pregnant, and it gets worse for women when they go through menopause. So as women are entering into puberty, every time they have a menstrual cycle, they're going to get shifts in their hormones. So the hormones are very closely related. And so again, the hormones are a very real thing. Does it mean that you have to have symptoms? No, it doesn't. There's so much that you can do. Does it mean that you're going to be ineffective and inept in a work environment? No. If you're male and listening to this, does this allow you to have a conversation about women's hormones? No, it does not. You do not. If you think it is a hormonal issue, what you want to do is this. You want to drop off a bottle of red wine and back slowly out of the room throwing chocolate. That's the only conversation you need at that time.
I love it. Yep. All right. So are there any specific hormonal imbalances that you're seeing often in your practice that people might mistake for purely mental health issues like anxiety or depression? Because in our practice, I do see this. I see young men that are coming into our office in their teens, and they have really high anxiety. They have really horrible depression. And they'll flat out tell me, I have a great life. I don't understand why I'm depressed. I don't know why I'm anxious. And very often many physicians overlook, even in teens and young adults, that there is actually a hormone imbalance occurring. And right now, my personal belief and all of the research that I've done is it's related to our food and our water and the toxins coming into us that way. But are you also seeing that pattern?
I am definitely seeing that pattern. And what I found really, really interesting is fairly early on in my career, I had the opportunity to work very closely with the Canadian Mental Health Association. And I was able to work, they have a very specific program in the area that I was in that was working with teens who were recently diagnosed with some type of psychosis. And it
Okay.
was really fascinating, especially with schizophrenia, that I was seeing the higher cortisol levels, and cortisol, again, that's that stress hormone, and issues with testosterone. So in psychosis, we often see higher levels of testosterone, especially in women.
Hmm.
And then dopamine levels, of course, are going to be higher. The dopamine is that neurotransmitter in the brain that is, they believe, is responsible for a psychotic episode. So it goes too high. And then ADD and ADHD, it's the exact opposite. The testosterone levels are typically low in young men, and the cortisol levels are still high. But the cortisol levels are low, and testosterone levels go really low dopamine and testosterone levels go really low in men who have, or young boys, teenage boys who are diagnosed with ADD and ADHD. Now, as you know, because you're in this field, food sensitivities, different chemicals, different heavy metals, they come into play, and nutrient deficiencies.
Oh,
We're talking about ADD and ADHD, definitely like zinc, look at iron, all of those things. But
yeah.
it's really interesting, again, to see with ADD and ADHD, the lower testosterone levels in men, in young boys.
Okay. Yeah. There's such a link with hormones and, the tie between physical health and mental health. So
Absolutely.
what is a real life example of a patient whose mental health dramatically improved after addressing a hormone issue?
There's really so many. One that is a little bit more current, so she's on my mind and on my heart. She actually, she'd been experiencing a little bit of anxiety issues. She had that through her life, but it was all very manageable. She said it started around the time that she entered into, her higher education and then starting work. But she could handle it. She learned some coping strategies, and she was managing very well. And then she got pregnant,
Oh,
and there was some challenges around the birth and around her baby's health around the birth. And then right after that, her baby had this infection, and then COVID hit.
oh my goodness.
Her anxiety went through the roof. There was post.
Valid reasons. Yeah.
Yeah, absolutely. So she had postpartum depression and anxiety, and the anxiety was continuing. And she was like, "Okay, look, I've been to see, different practitioners. My medical doctor is trying to say take these medications." She's like, "I'm breastfeeding. I don't necessarily want to do this. I want to get a handle on this." And she said, I notice it at shifting at certain different times, and I really feel it's related to my hormones. And she said as well, she said, with respect to therapy, like she's like, I've done therapy, I'm in therapy, but it's just not touching it. Like, can we look at hormones? And so the first thing that I said was, okay, yes. And there's actually a practitioner in my area who is really amazing at that. And so her and I had a discussion about, with respect to, he has some extra training in mental health issues. And I said, okay, you've got two options. Like, my area of expertise is more in the hormones. I can help you with mental health as well. But if you're right here,
Mhm.
this is the guy who, from a mental health perspective, because he has a lot of psychology training, I said, this is probably the best. This is someone you want to take a look at and interview at the same time. And
Yeah.
she interviewed us both, and she said, you know what? I really think this is the big piece, is the hormonal piece. So I want to work with you. So we said, great. So we talked, and we started doing some hormonal testing, and her hormones were really out of balance. And as soon as we started addressing that, no problem.
What are some natural ways that you do address hormones? when working with women?
Yeah, there's so many different ways. I mean, for me, because nutrition is my first love and first passion, I always start with nutrition. And I really start with dialing that in and taking a deep dive in terms of, what is really the nutrition that's right for your body? Because there's so much information and misinformation out there. And the information that's out there is cookie cutter. It's like,
Mhm.
this is what you should do in general.
Yeah.
And so it's not designed and tailored to what that individual body needs. And so some people's bodies do really well on a higher carbohydrate, plant-based, vegan, vegetarian way of eating. Some people's bodies do, and it's appropriate at certain times. Some people's bodies do really great on that Mediterranean way of eating, or something that would be more of a balanced way of eating, like paleo, right?
Mhm.
And
Yeah.
so they do really well on that. And the medical community right now is just in love with the Mediterranean way of eating. And there's lots of anti-inflammatory foods, which would decrease the inflammation, which is great because there's a lot of inflammation involved with those neurobehavioral disorders.
Absolutely.
And so that's really great. Some people actually do really well on something like a keto, which is high fat.
Mhm.
And like, it's very, very high fat. 60 to 80% of everything you eat is supposed to, like calories, is supposed to come from fat.
Mhm.
And so it's appropriate. I find that the foods themselves are healing tools.
Mhm.
And so you've got to shift up the foods that you're eating according to what your body's asking for. And I don't see anybody really addressing those issues. And if there's nutrient deficiencies or insufficiencies, they
Mhm.
have to be addressed, because if they're not, and if your blood sugar levels are going out of balance, everything you try to build on top of it isn't going to be helpful. There are different herbs that can be very, very helpful. There's
Mhm.
homeopathic remedies. There are different lifestyle techniques, all which are really great for balancing the hormones.
Mhm.
And so, again, even just the basic pillars of eat real food, drink fresh water that isn't, poisoned or toxic.
Right. Filtered, yes.
Yeah, get enough sleep at night.
Mhm.
Get the right type of exercise, because if you overtrain, you're going to raise cortisol levels, which most people don't tell you. And overtraining for women throws their hormones off balance.
Yeah.
So
So I'm actually glad that you just threw in sleep. So how does some of those lifestyle factors like sleep actually throw our hormones out of balance?
Oh, it's really interesting because, well, first of all, a couple of different ways. So if you don't get a consistent good night's sleep, you
Mhm.
can't rest and regenerate.
Right.
And then what's going to happen is it's going to affect your cortisol levels. Now, when cortisol, also, fun fact, another fun fact, when you don't get a good night's sleep, your body produces its own endocannabinoids. You heard it correct, folks.
Mhm.
Your body can produce something that looks very similar to cannabis. So, guess what? The next day, you're going to be hungry. You're going to get the munchies. You're going to want sugar, and you're going to eat and eat and eat. And that donut that everybody brings into the office that you normally can walk away from, it's going down. Like, that's just like
Yeah.
you are now being biologically hardwired. You're being basically biochemically manipulated to want the sugary foods. So
Yeah.
you're going to crave it. You're going to eat more. And then that's going to throw off inflammation. You're likely to eat something very sugary, something that is very high in simple carbohydrates, probably lots of gluten, maybe lots of dairy, things that are known to cause more inflammation. So the inflammation goes up, and then you start to feel bad. And then what can happen too is, if cortisol goes up, if this is happening for an extended period of time and cortisol does raise, well, when cortisol levels are high, they can prevent your body from being able to produce adequate amounts of testosterone and progesterone. And so they can actually shift the body at times even into producing more estrogen. And so we talked about women going through menopause. Men, right around the same time, they'll go through what's called andropause, where their testosterone levels will lower, and they'll
Mhm.
feel more tired. Their get up and go gets up and leaves. Their sex drive becomes a sex walk. They're just not interested in doing anything that they used to. And they start like losing muscle mass. So they get the skinny arms, skinny legs, but they start to develop the belly.
Mm-hmm.
And the weight around the midsection, when it's what's called visceral fat, so that's the fat that tends to pack around the internal organs,
Mm-hmm.
it has the ability. There's an enzyme called aromatase that can be in those fat cells that can take your testosterone and turn it into estrogen. Not a good look for men.
No.
No. That causes men, again, they're losing muscle mass, they're gaining more belly fat, but then the higher estrogen levels are going to tell them to put on weight more. So they're going to gain more weight, and then they're not going to feel good. So there's a lot of shifts that can happen when cortisol levels go off balance and when testosterone levels go low. And again, if you're not sleeping well. So all of those things, if you're not getting a good night's sleep, your hormone balance is going to be affected.
Yeah. So we work with a lot of people around sleep, whether it's in counseling or through neurofeedback, because sleep is such an important factor in our overall health, whether it's physical or mental health. We know that sleep is where we do all of our healing. Our cells are regenerating. You know, when we're children, that's when our bones and muscles and all of those things are growing. And definitely we have seen a trend in as people are aging, their sleep quality is decreasing. So we very frequently are doing things with clients around improving sleep, making sure they're getting enough sleep. We have women that have come into our office and they've said, you know, I get 6 hours of sleep. I should be fully rested. And I'm like, well, what do you mean 6 hours of sleep? If your body is telling you that you're not rested, then you're not getting enough sleep, period. It doesn't matter what the clock says. Because we're all
quality. Yep, it's the quality, not the quantity. And so, you know, this ties back to our earlier conversation, which I know you're really aware of too. If someone has experienced trauma as a child and that trauma happened late at night, decades later, it could be affecting the ability to get into restful sleep. And so I've actually had, it was a really interesting case because I had this wonderful gentleman, again, really high performer. And he's like, just the sleep's an issue. He's like, everything else, all my health, all great, but the sleep's an issue. And so then we looked at some of the hormones and we looked at what was happening at night, and the cortisol levels were high at night. And I was like, okay, you know, he's like, I don't get it, because he's like, I'm not really under stress at night. I think I manage my stress well, so I don't understand. I said, well, what happened in your childhood? Was there any type of abuse? Because I see it really common in children who are abused at night. They just they just can't get into sleep. Cortisol levels are high. They're expecting that trauma still. They're just stuck in that pattern. Even if they've done a whole bunch of work with some wonderful therapists to help them unpack that trauma, no matter what that healing work. And it was really interesting because he had said to me, you know, he said, actually, nothing happened to me. But when I was a child, you know, at night, my parents would often fight. And it would get really loud and it would wake me up at night, and it could get very volatile. His dad could be very volatile. And so that experience, even though he didn't consider that traumatic because it wasn't happening to him per se, that experience was still affecting his sleep.
Absolutely. Yeah.
Yeah.
Now, what have you seen as far as the link between addictive behavior like alcohol use and its effects on hormones?
Oh, so much. but one of the ones that, you know, again, when you ask me that question, like, there's so many cases that I can talk about and point to. One of the ones for me that was really fascinating was I had supervised at one point in time at a clinic that's associated, we call it a satellite clinic. So as a naturopathic doctor, we have to do, in our 4th year, we have to basically see patients, but we're being monitored by another naturopath, and we're treating basically under their license. So I was supervising a number of 4th year students at a clinic called the Sherburne Health Center here in Toronto, which works with a lot of people who are LGBTQ, but it also has a large population in that area that it draws from that are substance abuse, either survivors or maybe people who have been through substance abuse and stopped, or who are in the throes of substance abuse. And there was this one beautiful and wonderful man who came in, and he had, we were treating him for his health, and he had said, yeah, he said, I'm not abusing anymore, but I used to be an alcoholic. And he said, I am an alcoholic. I haven't drank, in years, but this is, basically me. And he had the big gut and the skinny legs and the skinny arms. And he's like, he was trying to lose weight. And he's like, I'm biking all the time. I don't get it. Why isn't this not coming off? I think I'm eating healthy. And I was like, tell me about the alcohol. What type of alcohol was it? And he said, oh, it was beer. He said, I love my beer. Right. Yep. So beer, not good for men. So beer contains hops. Hops is a herb that can raise estrogen levels.
Absolutely.
This is why women use it to get the breast milk to come in, right? Yep. And if you're Irish, you've heard of the stories. Drink some Guinness, your breast milk will be fantastic. Yep. The hops actually increases estrogen. So you have increased estrogen in someone who is an alcoholic who is getting nutrient depleted, because all their calories most of the calories are coming from alcohol. They're not really eating by the time they hit that full level. Yep. And so you're getting nutrient depleted. Then he had hit andropause. So again, the testosterone levels were so low because he was also having the beer belly. He had the beer increasing the estrogen, and then the belly fat was increasing the estrogen in him. He had no testosterone. So no wonder you're biking, but you can't build muscle mass because you don't have the testosterone levels. You have too much estrogen, and so again, you're just burning off your muscle tissue when you're on that bike. You're not doing the right stuff. Right. So that's probably one of the most fun. But, again, as soon as you have someone who is starting to get into a lot of substance use, that's going to affect the neurotransmitter production and the receptors. And I think one of the biggest things that I want people to know about is there are a lot of people who have substance use and very regular and chronic substance use, because they're trying to mask a neurobehavioral disorder.
Absolutely. Yeah.
One of the things that's really common that I see is in people who experience anxiety and they start cannabis, and they're like, oh, immediately I feel that relaxation. Immediately I feel the anxiety calm down. And so they start self-medicating using cannabis. And there are a lot of people who feel like, well, alcohol is worse than cannabis. Or there's a lot of people who feel that, smoking is also worse than cannabis. And they do have their health adverse effects for sure. With cannabis, though, what you have to realize is that fantastic neurotransmitter in our brain called GABA. This is one that helps our brain calm down. This is one that helps us with anxiety and PTSD and is responsible for that deep level of sleep that we get at night. When you have regular cannabis use, it can actually decrease the receptor sites in your brain that pull GABA into your nerves and into the cells. So you get a decreased ability to utilize the GABA that's floating around in your brain. So you feel really calm when you're using cannabis, but then when you stop, over time, you need more and more of it. You feel worse and worse and worse. The anxiety increases in between the cannabis use.
Yeah, we've often seen like young adults, 19 and 20, who've been using for a few years, and they're coming to our office because they're actually starting to experience symptoms of psychosis that have been caused by cannabis use for a long period of time.
Yeah. And I don't think a lot of teenagers know that. I've overheard a lot of conversations among teens and young adults where they're like, oh, I use cannabis. No, I would never touch alcohol. Alcohol is so bad for you, but cannabis is fine. It's so harmless. And I've heard politicians here in Canada I shall remain nameless, but there were certain politicians that I was hearing that who felt the same way. And I'm like, no, we gotta educate some people here.
Absolutely. Yeah. Okay, so right now there's a lot of buzz on the internet and just in general about, biohacking and hormone hacking and all of those things. So, what is one trend that you find is legitimate, and what is one that you feel is completely overhyped in its relation to hormone hacking and being able to fix the physical and mental health symptoms?
Yes. Don't do it. First of all, I hate the word hack. So my experience is whenever you go to hack your body,
Mhm,
it's going to fight back. Your body knows better than you do.
mhm,
Everything that's happening, every symptom you have is your body trying to tell you what it needs for its care,
mhm,
its nurturing, its feeding, its rest. It's telling you something about what's not serving you.
mhm,
It is, it's just a sign.
mhm.
It's just your body's way of trying to communicate with you. That
Absolutely.
is all. So, yes, there are neurobehavioral disorders where actually you have something like a lower level of a neurotransmitter, like maybe or higher level. So in psychosis, maybe higher dopamine at certain times, maybe, again, for PTSD or for sleep issues, maybe lower GABA, maybe for anxiety, same thing. There are people who have lowered levels of those neurotransmitters, and that's like someone who's a diabetic. If you don't have insulin, you need insulin, right? You need that injected into you in order to make sure that you can digest your sugar, right? So I'm not saying that, oh, every mental health issue, every neurobehavioral disorder has a natural cure, because guess what? If you have a true disease process, again, like the same as a diabetic, if you're a type 1 diabetic, you need insulin for the rest of your life. You need that outside source.
Yep.
It's the same thing. Like you need this, you're going to need some medication, and like, let's just move on. Like, let's do the best that we can to get you on the lowest dose possible, which we always want to do.
Mhm,
Your psychiatrist is going to be on board with that. Your medical doctor is going to be on board with that, but we need to make sure that we address that. But for a lot of people, when we take a look at this idea of health hacking,
mhm,
your body's going to fight back. So you're going to do something, you're going to try to force it into something.
mhm,
And as soon as you stop, or even sometimes when you don't, it's going to push back twice as hard
mhm,
because you're not addressing the underlying symptoms. So I hate the idea of hacking
mhm.
anything. Do not hack your body. That's so cruel. You wouldn't do that to an animal. You wouldn't do that to, yeah, hopefully you wouldn't do that to a sibling or a child, like go hack your child. No, do not do that to your body. Please treat it with respect and dignity. It's the only one you've got this entire lifetime. So, also, one of the things that when I was teaching at the Canadian College of Naturopathic Medicine and I was teaching at the Canadian School of Natural Nutrition, as soon as I got my first students for the first time, like, okay, this is our first class together. Here's what you're going to learn.
Mhm.
Number one, don't trust anybody. Number two, we're all going to die. That's how I start. Like, listen, do not trust anybody. Oh, it's on TikTok. It must be right. Yeah. How did that go? Like swallowing that pot of like dish detergent or like laundry detergent. Like, no, no.
Mhm.
Again, the health information that's out there, 90% of it is wrong. Also, who are you getting your information from? An
Mhm.
influencer who's being paid by a company to tell you something? An
Mhm.
influencer who wants to say something controversial just to get numbers and just to get clicks and likes? Most of the people who are out there have no idea what they are talking about. And if they do know what they're talking about, they're not talking directly to you.
Mhm.
They don't know your body. They don't know your biochemistry. They don't know your lifestyle. They don't know your allergies. They don't know the medications you're on. Do not
Mhm.
trust them.
Yeah, I tell everybody we're all so unique. There is not a one size fits all because I get the question all the time of, well, what do you think are the most beneficial vitamin protocols? I'm sorry, I don't have an answer for you for that
Yeah.
because you are so different from me, and even my own child is completely different from me because they have a secondary, genetic contributor that assigned and gave them genes that work differently for them. So how even I respond to, vitamin D or my need for vitamin D versus yours can be vastly different.
Yeah, I would agree 100%. And I think what you said is 100% spot on. And I'm going to start using that. So if people start asking me, what's the best vitamin and mineral protocol for X, I'm going to say the one that's designed specifically for your DNA and your body's biochemistry.
Yep. Yep. Okay.
And your health goals. Like, what do you want to accomplish?
Absolutely. Yeah, because that's different and unique for everybody as well. And then, in our house, like I'm using completely filtered water. We use trace minerals, and we're making sure that all of our food is, as organic as humanly possible. We're using local farmers who are not vaccinating their herds. They're not giving them additional hormones. They don't give them antibiotics. So I have a much healthier diet than some of the clients that are coming into my office. So even that, is going to change. What is it that you need versus what I need?
Right. A friend of mine used to call that he said there's because he grew up on a farm, and he was like, okay, there's a difference between the white eggs and the brown eggs, and I'm only eating the brown eggs because they're from happy chickens. It was the funniest thing, but he's like, let your chickens run around outdoors and eat real food. I want the happy chickens. So I have this image always, like, that when you get a farmer who is, raising cows that get to walk around and eat grass, and I'm like, those are happy cows, chickens that get to run around. Those are happy chickens. So that's what you want. Happy cow and happy chicken food. And happy fish food.
Absolutely.
No Frankenfoods.
All right. So as our last question, if someone is struggling with mental health and suspects hormones might be involved, what is the first step that they should take to get answers?
The first step is that they should research and look into and contact a qualified practitioner in their area who can do that type of testing.
So one of the things that we have clients that experience, so I can order hormone testing for adults, but I can't order it for children or teens, anybody under the age of 18. And we're getting primary care practitioners that are pushing back and saying, no, we don't hormone test on anybody under the age of 18.
Yeah. And a really good qualified naturopathic doctor who is trained very specifically in those type of hormones and those type of testing and how to read them is who you want to really be associated with. And I'm really glad that you asked this question, because the truth is that, I've been a naturopathic doctor for 25 years. I've taught at the Canadian College of Naturopathic Medicine. I've taught I've given lectures for a number of the different laboratories that I am associated with, or that I've used in my practice because of my experience with them and because of the use of them. I've taught other naturopaths how to read them, also other medical doctors and functional medicine doctors. I have also, again, spoken for my naturopathic association on different techniques. So I've really found, and I've had a lot of feedback from my patients, that with respect to being a naturopath, being a functional medicine doctor, being a chiropractor who's ordering these tests, it doesn't mean they know how to read them. Yes. And so I've had that experience when I had a patient come to me that her medical doctor was saying, hey, she was working with a functional medicine doctor who said, I think you should do these tests, but I don't really do them. I don't know how to read them. Go and see a naturopath. So she went to the naturopath, and the naturopath said, I'll order these tests for you, but I don't know how to read them. I don't know what to do with them. Mm-hmm. So she came to me with these tests, and I said, well, it's great that we have this information, but if you just go to someone who doesn't know what to do with them or how to really properly read them, it's not giving you any advice that is going to be utilizable. Right. We always want to do a test that is actually going to give us information that's going to inform our protocols. Mm-hmm. And so I'm in the process right now with another colleague of mine that you know of, and we're actually designing a complete program. And I'm actually going to start getting a program out there to teach functional medicine doctors, chiropractors, naturopathic doctors, and other healthcare practitioners that have the availability to order those tests, how to actually read them, how to utilize them, how to break them down and get the actual clinical results and sustainable results that you need. And so I'm happy to help in terms of facilitating that. I'm going to be certifying them according to, I'm going to give them like my stamp of approval, a special, certification, Dr. Val approved, boop. It'll be called something else, but in the meantime, I'm really happy for you to reach out. Anybody can reach out. They can book a fireside chat with me. There's no charge for that. It's a complimentary call. And I can help kind of guide them as to, okay, what are the practitioners? Who are the practitioners that you need to work with in your area? And then as these people are being trained and coming on board, we're actually going to have like a website that says these are the people we approve of. That's going to help in terms of supporting that, because we actually do need people who, it's one, because again, as you're noticing, it's one thing to say, hey, I need someone who can order these tests. That's fine. But if that person doesn't know how to read them or how to apply it, it's completely useless. It's invalid.
Yeah, we've definitely run into that where they've come back with the hormone panels and the doctor's like, well, everything's inside of normal ranges, but then they're not inside of the ranges they're supposed to be with each other. So that's a problem too.
Huge. Yeah, absolutely.
Yeah. And I'll make sure that I get your contact information so we can share that with everybody who is watching. So.
Absolutely.
All right. Well, thank you so much, Dr. Val. I am so glad that we got to have this conversation and that we get to share this with everyone who may actually be struggling with hormone issues and they don't even know it yet.
Absolutely. And thank you so much. I've really enjoyed the time, and I always love getting knowledge out there, but I saw that I made you laugh a little bit too. And that I like that too. It has to be fun. And this was so much fun. I really enjoyed it.
I am so glad. All right. Thank you so much for your time. And everybody, we will include all of Dr. Val's contact information. And if you think that someone in your family may be dealing with a mental health issue that could be stemming from hormones, we highly recommend working with Dr. Val to get to the root cause.